Level 1. No coverage. The pain started on Tuesday. It's Saturday now. You've been managing it the way people without insurance manage things. Ibuprofen, water, a heating pad, and a running calculation in the back of your head about how bad it would have to get. At 4 a.m. Sunday, it gets that bad. You drive yourself. That's the first decision. An ambulance is $1,200 before anyone touches you, so you drive, with one hand on the wheel and the other pressed against your side, through empty streets, running a red light because nobody's coming. The emergency room at 4:20 in the morning is fluorescent and full. The woman at the desk asks for your insurance card. You say you don't have one. She doesn't react. She's asked this question 9,000 times. She slides a different form across the counter, the self-pay form, and asks for a card to hold on file. You sit down in a plastic chair. Here's what nobody tells you about being uninsured. You are not refused. That's not how it works. Nobody says no. You are simply moved to the back of a line that never formally exists. 3 hours pass. A man who came in after you goes back before you. You don't know why. You will never know why. There's no board, no numbers, no explanation. There is only a door that opens and a name that isn't yours. At 7:40, someone finally sees you. He is competent, tired, and 11 minutes long. He palpates your abdomen, asks 4 questions, and orders blood work. He does not order the scan. You understand why. You'd made a point of mentioning that you're self-pay. You mentioned it because you thought it was relevant information. It was. At 9:15, he comes back and tells you it's probably muscular. Probably. Take these. Follow up with your primary care physician. You don't have a primary care physician. That's what a primary care physician is. A thing you have. The bill arrives 19 days later. $4,360 for 3 hours of waiting, 11 minutes of contact, and the word probably. You call the billing department. You ask about financial assistance. They say you can apply. The application requires 2 years of tax returns, 3 months of bank statements, and a decision that takes 90 days. During those 90 days, the account continues to age. The first rule: without insurance, you don't get worse care. You get slower care, shorter care, and less certain care, and then you get billed for the uncertainty. Level 2. The high deductible plan. You get a job with benefits and for about a week you feel protected. Then you read the plan. $6,800 deductible, which means the insurance company will begin paying for things after you have paid $6,800, which you do not have, which means functionally you are insured against catastrophe and nothing else. You pay $240 a month for this. That's $2,800 a year, out of your paycheck, before you receive a single dollar of benefit. You are paying for the right to eventually pay. So you behave exactly the way you did with no insurance at all. You don't go. The pain in your side comes back in March and you wait it out again, because a visit is $200 out of pocket and you're not meeting that deductible this year, or any year, unless something terrible happens. Here's the strange psychology of it. You now have insurance, and you use less healthcare than you did before, because before you were desperate, and now you're calculating. In August, you finally book a physical, because it's free, preventive care, covered at 100%. It says so on the website. The physical is free. The blood work ordered during the physical is not. Nobody mentions this in the room. You find out 4 weeks later, in an envelope. $390, coded as diagnostic rather than preventive, because you answered honestly when the doctor asked if anything had been bothering you. If you'd said no, it would have been free. You didn't know that. There was no way for you to know that. The billing code was decided in a sentence you didn't recognize as a financial transaction. You call. The representative is kind and reads a script. The code is correct. The code is always correct. You can file an appeal. You don't file an appeal. The second rule: a high deductible doesn't get you into the system. It gets you close enough to see inside, while making sure every step through the door still costs you. Level 3. The real employer plan. You change jobs and the difference is immediate. $1,500 deductible, $30 copay, a network with actual hospitals in it. On your first day of coverage, you make 3 appointments in one afternoon for things you've been carrying for 2 years. The primary care physician you get assigned is a woman named Dr. Ree. You will see her for 11 minutes at a time, 4 times a year, for the next several years, and she will be the closest thing you've had to continuity of care in your adult life. She's good. That's the thing. She's genuinely good, and she has 14 minutes scheduled per patient and runs about 9 minutes behind by 10 in the morning, so what she actually has is 11. You learn to be efficient. You bring a list. You lead with the most important thing because you know the visit will end before you get through the list. You've become skilled at being a patient the way people become skilled at anything they do under a timer. She orders the scan for your side. Prior authorization required. That's a phrase you now know. It means your insurance company will review whether the doctor's medical judgment is necessary. It takes 11 days. It's approved. The scan finds nothing serious. 2 years of wondering, resolved in 11 days and $140. And the only reason it took 2 years is that you didn't have the right card in your wallet. You do the math on this, and then you stop doing the math on this. Because there's a version of the arithmetic that leads somewhere you don't want to go. You're in the system now. Properly for the first time. Referrals go through. Specialists have openings in 6 to 9 weeks. The machine works. You just have to move at the speed the machine moves. And the machine was not built to move at the speed of a person who is frightened. The third rule. Good insurance doesn't buy you attention. It buys you access to a queue, and the queue is the same length for everyone standing in it. Level 4. The executive plan. The new job comes with something called an executive health benefit, and you assume it's a marketing term until you use it. You call a number. A person answers. Not a menu. A person, on the second ring, who has your file open before you've finished your name. You describe the problem. She asks 2 clarifying questions. She says she can get you in Thursday. Thursday. It's Monday. You say something like, "Are you sure?" Because 11 days for a prior authorization is the water you've been swimming in, and she says, "Yes, Thursday at 2, and would you prefer the location downtown or the one closer to your office?" The appointment is 40 minutes long. Not 11. 40. Nobody is behind schedule. There is no waiting room in the sense you understand waiting rooms. There's a small room with coffee in it and 3 chairs, and you sit in one of them for 4 minutes. The doctor comes in and sits down. That's the part that undoes you a little. He sits down, and he doesn't touch a keyboard for the first 6 minutes, and he asks you to describe the history from the beginning. And when you get to the part about waiting 2 years, he doesn't say anything about it, but something crosses his face. You have been in this system your entire adult life, and this is the first time a physician has had the time to look surprised on your behalf. The scan is ordered and performed the same week. No prior authorization. The plan doesn't require it. The results are called to you by the doctor himself, not a portal message, not a nurse line. Here's what didn't change. Your body. The same organ, the same history, the same person. What changed is that a different administrator, in a different building, applying a different set of rules, decided that this time, the doctor's judgment did not require review. The fourth rule. At every level below this one, someone was standing between you and your physician. At this level, nobody removed them. They were just never assigned to you in the first place. Level 5. Concierge. You don't have a plan anymore. You have a physician. $22,000 a year, on top of insurance, which you still carry for hospitals and surgery. This buys you a doctor with 300 patients instead of 2,400. He gives you his cell phone number on the first visit. You assume this is ceremonial. It isn't. You text him on a Sunday about a rash, and he answers in 9 minutes. The annual physical takes 3 hours. Not 11 minutes, 3 hours. Blood work with panels you've never heard of. Imaging. A conversation about your father's heart that goes on for 20 minutes because there's no reason for it not to. When you need a specialist, he doesn't refer you. He calls someone. There is a difference between a referral and a phone call, and the difference is roughly 5 weeks. And here is the thing you notice, sitting in his office with no one waiting behind you. He is not a better doctor than Dr. Ree. He might be a worse one. Dr. Ree saw more pathology in a month than this man sees in a year. She was sharper because she had to be, faster because she had no choice, and she caught things in 11 minutes that took him 3 hours to arrive at. What you're buying isn't skill, you're buying his time, which means you're buying his attention, which means you're buying the possibility that he notices something. Medicine at every level is pattern recognition performed by a tired human being, and the single largest variable in whether that human being sees the pattern is how long they are permitted to look at you. That's it. That's the whole thing. Not competence, duration. You are paying $22,000 a year for someone to be allowed to look longer. The fifth rule. You were never buying better medicine. At every level, you were buying minutes, and the price of a minute is set by how many of you there are. Somewhere right now it's 4 a.m. and someone is driving themselves to an emergency room with one hand pressed against their side. They ran a red light because nobody was coming. They parked far away because they don't know what the lot costs. They will tell the woman at the desk that they're self-pay, and she will slide a different form across the counter, and she will not react, because she has done this 9,000 times. They will sit in a plastic chair for 3 hours and watch a door open for names that are not theirs. At 7:40, someone will see them for 11 minutes and say probably. Their body is the same body. The pain is in the same place. The medicine that would fix it exists, and it has existed the entire time, in a building they are currently sitting inside of. The system is not broken. Nobody in that building did anything wrong. The nurse is doing her job, the doctor is doing his, the woman at the desk is doing hers, and the bill will be calculated correctly by a program that has never been wrong. You are the same patient at every level. The only thing that changes is how long someone is allowed to look at you,